All right, Brady, go ahead. Perfect. Gotta love that voice from Zoom. But just letting you guys know it is being recorded now. So in addition to the team here with us from the Oral Health Collaborative, we also have some of the current grantees. We're gonna really highlight Dr. Ellie Steele. So Ellie, if you can just unmute and say hello.
Hi, everyone. It's great to see so many people interested in applying.
And then her sidekick, Janie Woody.
Hey everyone, nice to be able to talk with everyone today.
And then we also have Dr. Francisco Rios, which I'm not sure if he has made it on the call just yet, but hopefully he'll be joining us a little bit later. All right. So for today's agenda, we're really going to focus on the why, how, and when. And so again, the whole purpose of this info session is to make sure that folks really have a good grasp and understanding of the intent and the potential impact that this grant has already made in the communities across North and South Carolina, but also how you can participate and also become a grantee, hopefully. And so we want to make sure that your questions are answered. Please feel free to put those in the chat. And again, there will be a dedicated section of the session to go through any of the questions that you have. Those that we don't answer, we will make sure that we loop back with you to correspondent and hopefully connect you to the right folks to get that question answered. All right, so Ellie is up first in the video, but I wanted to show really and kind of frame us for this session around the why. So we're going to take a moment to actually stop sharing for a second so I can make sure audio is included. All right, now we're going to watch a short clip.
There is not going to be a school district in this state, there is not going to be a community in this state that would not benefit from having a school-based program and being able to go out with the support that the Duke Endowment and Blue Cross Blue Shield grant gives you. You're going to have guidance and help on every step of the way.
School-based care is important because that's where kids are. That's where kids spend the majority of their time, and by taking the care to them, we can create conveniences for their families, for their parents, and ensure that they're getting the routine services that they need over the course of years.
We were doing a lot of extractions, so we saw that finding a way to provide more access to our kids in the schools was the way to go.
We realized that one of the big ways that we were failing our patients was not getting to them, not providing the care where they are themselves. So by bringing the care to them, which for a lot of children is at school 10 months of the year, we are able to cut that barrier down and really provide the comprehensive care instead of just the limited emergency care.
We have children that those parents are both working, and it's very hard for them to take off work to spend a day at a dental office that may be an hour away. And so children often go a year, 2, 3 years without seeing any dentists in some of these rural communities. And with school-based programs, we know that they're getting the care, we know that they're getting seen.
The idea is that the school it becomes a part of the dental home.
The kids were really excited about coming. A lot of times when we went to the classrooms to get them, they would ask if they could come again, or is it my turn yet?
We make it fun for them. We do anything that needs to be done. We sing, we dance, we play games.
This is just another way for us to expand out into the community and to different areas of North Carolina to increase access to rural dental health care.
We were able to complete more treatment plans that we usually do because we were seeing those kids more frequently. So definitely we improved the access to services to our patients.
The Duke Endowment and Blue Cross Blue Shield grant really helped us expand how often and how many days we can spend at each school. We were able to purchase a second portable dental unit so that we are able to go to 2 schools at one time. This allows us to reach double the amount of kids and provide care that's not just preventive and focus on doing other treatments such as basic restorative or education and sealants.
try not to miss this opportunity because it's a great advantage.
With this school-based program or any mobile portable program, we are really providing a service to our patients that we are cutting through those barriers. And I say that the biggest advice is just do it.
All right, so you heard it right from Ellie. I guess we're finished with today's session. Just do it, just apply. But Francisco, Dr. Rios, I did see that you joined us as well. So I wanted to have a moment for you to unmute and introduce yourself to the group. Thought I saw him come in. Dr. Rios, are you with us? He's here. He may be having some difficulties with the audio. All right, Francisco, we'll come back to you. But I did want to just give a really quick overview of just really the impact that this grant initiative has had thus far. And so we're leading into cohort 4 of 5 cohorts. And so cohort 4 is what we're recruiting for right now, and potentially would be where you would apply. But you'll see on the screen just really the diversity and geographic spread in terms of who has participated and who is currently a grantee of this initiative through cohorts 1, 2, and then obviously 3, and then 4 is you. And so again, we're hoping that today's session helps answer any lingering questions that you have and really helps ease your mind and bring you into comfort to apply for this grant. Here's the geographic spread. So the dots that you see on the North Carolina map here are the access points in the schools that are actually operational or plan to be operational through those 3 cohorts that we just went through. So you can see that the Duke Endowment and the Blue Cross Blue Shield foundations of both North and South Carolina have done a really fantastic job trying to make sure that there's diversity and geographic spread of where the impact of their grantees are in the state. Definitely do have some work to do, around the eastern part of the state is not surprising to see. And I'm really, really excited that a lot of the folks on this call today actually represent those kind of gap areas currently. And again, hoping that we're able to make your decision easy to move forward with building school-based oral health programs. All right, so I'm going to turn it over to Dr. Ellie Steele and Janie, and then Dr. Francisco Rios as well at this time. And so these are questions that were pre-populated based on a lot of your correspondences with us. These are the questions that we wanted to make sure that you had a chance to hear from current grantees on. So Ellie, as last time in session 1, I'm going to go ahead and put you on the spot to start. And so I want to ask what helped to make the decision to expand services into school-based programs. So as you already have a really robust, comprehensive suite of dental services at Cabarrus Health Alliance, how did you make that decision to expand into school-based programs and really what drove that decision?
Well, and Janie can absolutely lead into this as well, but the biggest thing is we were going to the schools and seeing need after need not being met by us. As someone who was at the schools where we would only make it once a year or not make it to every single school for as many days of preventive treatment as we could do, we were seeing that kids, based on their insurance, based on their treatment plans, we were the only dentist they were seeing that entire year or every 2 years. And I know that as a clinician, it's heartbreaking to see kids whose cavities, start out as just sealants, and then over time you see them get bigger and bigger and bigger till they're bombed out and have to have extractions or other treatment. But it's really sad to realize that we aren't providing the care that we are capable of. And so the second mobile unit for us, or second portable unit for us, has really allowed us to meet those needs as much as we can. There's always room for improvement and more outreach, but we are able to see the kids at least twice a year. We're able to spend more days doing that restorative treatment, and we're still making sure that we are providing that site or that care on site so that the parents don't have to take off of school or work and worry about transportation issues. There is so much need in all of our communities, and there's so much need, especially for these children who haven't been at schools for the past year and have been eating snacks and soda and juice all day long while they're on their virtual Zoom calls, just like I was just doing. And so we want to make sure that we are providing the care as much as we possibly can where the children are at.
Thank you, Ellie. And Janie, I'll throw it over to you to kind of build upon that.
Sure. So just like Dr. Steele was saying, the decision for us to expand was just based on what we were already seeing. And I will back up a little bit further. And, you know, one of the reasons we ventured into several years ago, the going and taking services to the community at the sites where patients and students and children were, is because we knew and started identifying those barriers, those social determinants of health problems that people were facing to get to us. And so, again, like Ellie said, we would go to a school and we may not make it back there till the next year or the following year. And we would know and start to track and see that those children had not received any type of preventive or restorative or any type of service for that length of time. Years ago, when we were just in the elementary schools, we would notice that we would see them in the elementary school. And then as the years went by and we were able, fortunately, to start into our middle schools and now into our high schools, we would see that some children, by the time they got to the middle school, had not been seen by a dentist since early on in their elementary years. So they were not able to go to the clinics, even though there were clinics that were set up to see children in those needs. And so really taking access out to the community is what was our driving decision for everything we do right now.
Absolutely. Dr. Rios, I see you. You were able to join us. Welcome. I think you're muted though.
Okay, now do you hear me?
Yes. Welcome.
Okay, how you doing? Good?
Good. Yeah, you have a big crowd today. I think it's all the dancing and singing. You'll probably have to start with that. It's what you said in your video that you do in your school-based program. So we want to hear it.
Okay, you want to hear about that? Wow, okay. Well, the first thing I'm going to do, I just returned from vacation, so nothing is working here. I'm trying to do my best to get used. I pull out my laptop. That's why you're hearing me from my laptop, and my desktop is not working. Well,
okay.
About the school-based program, the first thing I want to mention is that when we were evaluating the amount of patients and the type of patient that we see here in the clinic, we noticed that the amount of kids that we were seeing was really low. And so we start digging, start researching with a fellow dentist in our dental director meeting. And that's why I get more of the information of what was happening. And our biggest concern was that the services in the schools were being provided by a private dental van, that it would come to the schools and then they would provide preventive service and leave the kids without comprehensive dental care. So we wanted to be like the dental home for our patients in our community. As one of my staff mentioned, we want to take care of the patients in our community because that's our responsibility as a community health center to take care of our patients. So that's what started basically that program, and we gather all the information about the schools. The school-based program is a great program, if you want to say, because when we go to the schools, kids feel like they're in a more comfortable environment because they are with their peers, so they feel more safe, different from bringing them to the office where everything is different, everything is strange. their peers support each other. And the part about dancing and singing is that sometimes kids come a little bit nervous. And so we start either singing, we dance, we play with them, and we try to present ourselves as their buddies and peers. And it looks like I'm kind of good at that. So sometimes I feel that I do some things that are, you want to say funny or crazy, but kids enjoy it. And that kind of opens the door when other kids see that you're playing with them, they just are more receptive to dental services.
Absolutely. Well, we'll need to get Brady to record you doing that. I haven't seen it yet, but I heard it's epic.
Yeah, yeah. Well, there's a video, but I don't think it includes a part of the singing or the dancing. And the part that I encourage my staff also to participate on that. But I don't know, it's that kid inside me that always comes out and just help me take care of these kids.
Absolutely. I kind of want to shift gears just a little bit to focus on some of the barriers. So I didn't send these questions to you all in advance, some of the qualifying questions. So not to put you on the spot, but folks are really interested to know, how did you sell this to the C-suite? So the folks that need to make and sign off on your expansion projects and pursuing this grant, what was the ROI? So what was the return on investment? How did you actually pitch that to your leadership to get them on board to make this decision to apply for the grant and then expand into school-based programs? And anyone can take that.
I can jump in on that one. As far as for us in Cabarrus County, having a dental clinic fixed site for many years, we were able to definitely show some data on the numbers of students or the number of kids that were being seen within the clinics, and also going out to the schools and doing kindergarten screenings was also another factor that we used to show the need. So we took our kindergarten screenings and was able to show what is the decay rate among kindergartners. Seeing that and being able to track that even for 1 year, but if you're able to show that for a couple years, I know the North Carolina Oral Health section has the decay rates for, I think it's regional right now, but it used to be individual county level data. That was very important for us to be able to show, are decay rates rising among our kindergartners, or, are we steady? What is that rate? And once people started to see and understand that the decay rate was that high, and then what education-wise goes into a child that is in kindergarten having decay, what does that look like? Does it cause them to miss school because of pain? Does it cause them not to be able to be ready and able to learn fully because they're having dental pain? Those type of things really helped touch the heart of those that needed to hear the message and understand the message, and just being able to bring it really down home to where we live. So I really encourage folks, if you have access to any type of data, to be able to share that and then bring the story along with that.
Absolutely. And we're a state in which lots of agencies have data. So one thing I just want to say, as you pursue this grant opportunity, perhaps, and you would like specific data, don't hesitate to reach out. If the Oral Health Collaborative doesn't currently house or have that data, we can connect you to the folks that do, and make sure that you get what you need when you're selling this to the folks that need to sign off. Ellie, is there anything that you would add? I know that you and I have talked a lot about value and really making sure that we address social determinants of health, particularly transportation barriers, and school-based programs are such an excellent way to do that. Have you seen, and I'll just throw it out, we're real here, and not everything is rainbows and sunshines, but some of the barriers are around mission and margin. So we all have the mission to serve, I hope, but sometimes the margin people are fearful of to make sure that they can financially sustain this program. And sustainability of this type of initiative is so vitally important particularly to access to care. So Ellie, can you speak a little bit about that? And then Dr. Rios, I'm going to flip it to you for the same question. Specifically how this has worked out. So this is your mission, and how is your margin? Are you able to expand really even some of your opportunities for financial sustainability through this program?
Well, I'm going to be a broken record, but Janie has a lot of that data. But what I would like to say is that our mission and our margin is actually probably going to be a little easier now that there are some new policies and new laws and that have passed in North Carolina. So teledentistry being codified and being accepted by the board and going to be probably reimbursed by Medicaid is going to be a huge way to increase our reach while still providing that comprehensive care back in clinic as well. So in previous years, we've had a dentist going out to the schools, and unfortunately, a lot of my value is not by doing cleanings when a hygienist is better at it than I am. My value comes from being able to help with that decay and that treatment that hasn't been done in years. And by being able to utilize NC 16W and teledentistry rules, we're able to have a hygienist out at the schools while also having a dentist in our office providing comprehensive care, but also going out not for the cleaning days, but for that comprehensive treatment days out on mobile. So mission and margins are going to get hopefully less stressful as we move towards that program, but preventive treatment is always worth it for our mission and can be good for our margin as well. I'm going to let Janie comment on that.
Sure. So taking that a little bit further, so definitely margin is important to the powers that be. Those that are making those decisions ultimately, and you want them to buy in, they care about that margin. And you have to financially find a way to be sustainable. And so how do we do that? I would say our biggest thing that helps is to pre-plan, prepare before you go. So we typically advertise, or however you want to call that, give consent forms to every student at the school. And then every student that turns in a consent form and wants to be seen can be seen. But we proactively research, identify their insurance. If they have a billable insurance, we definitely bill those services to the insurance so that we are getting some reimbursements. And I think that is the biggest thing. Some folks have a concept that you're there to just give services or do services for free. And as much as we would love to do that, if we are not able to sustain ourselves, we're not going to be able to serve anyone. And so you have to proactively look at that and then set up the standards so that you know how many students you need to see per day, what is your reimbursement rate, making sure that things get billed in a timely manner so that you've got that revenue source coming back into the program. All of those things I think are very important. And I will just throw out, I think the Duke Endowment advisors and folks have been wonderful to help us work through that to make sure there's tools and resources that they will share with the group that really helps identify how to do that and gets the numbers for you so that you know and you're aware going in. It's one of those things you don't want to go through half the year and realize we are not breaking even. We are not at the point that we can sustain this. So it's really looking on a monthly basis to make sure that you know where you are.
Well, Janie, either you remembered the slide deck from before or you just read my mind, because you teed it up really nicely to move into the support that you'll receive, through this grant initiative, through the wonderful technical assistance team. But Dr. Rios, I wanted to give you a chance also to weigh in before we advance the slide.
Yes. Well, if I'm gonna read from our mission. Our mission is to provide quality and accessible healthcare services to our people in our community in the most cost-effective manner, and that's the base. But also, the school-based program is gonna be a way that you can balance your finances between when you serve the serve under the slide scale. That most of you know that they pay a minimum for their services, so that's a way you can balance those type of services, and it will give you some leeway space so we can take care of other underserved patients. I also want to mention that in the schools, you gotta find out a way to be productive, and that's that key. And you have to realize what is the number of patients that you have to see each day. I'm lucky enough that I have a patient navigator that she has been in the military for more than 20 years. So we run like a tight military style clinic, and she kind of follow up. She prepares everything in advance before going to the school. So we have a schedule prepared with all the insurance information, all the patient medical history is already taken care. So when we go to schools, we basically see patients. And even though we have our computers and everything there, we do paper charts so we can gather all the information as quick as we can. Then we return to the clinic in the afternoon and we enter all that information in our data banks. So that's a way that you can make it more productive. Because definitely, if you want to go to the schools, you have to be productive so you can prove your C-suite that you are making money. Even though the primary objective is to see or give care to the patient, you have to be productive. So when you are doing this on your own, you can be self-sustained and really contribute to the finances of the center.
Absolutely. Yeah. And I think, the thread through between the three of you is that it's not insurmountable, that you're really able to work through some of these challenges using data as your guide, and then really understanding how to reform your operations to build effective and sustainable school-based programs. And I know I've spoken with you all kind of offline about this and other grantees of this initiative, but the common comment that's made to me is, the end result is a sustainable, effective, and efficient school-based oral health program. And the Duke Endowment grant with Blue Cross Foundations really helped you launch that and gave you the tools and the foundation necessary to be successful long-term. So I'm really excited to kind of dive in now to some of the folks that will be helping should you apply and receive a grant. So we're going to talk a little bit now about, actually, I'm going to skip slides here and come back to this, but the technical assistance team, I wanted just to throw out and make sure folks are aware of who they are. So Dr. Moss, I think you're on the call. If you can unmute and just say hello.
Hello, good to see everybody. This is wonderful.
Dr. Moss, anything you would add so far?
No, I really like the idea that we're trying to use data to help support the work that's being done so that programs can be sustainable yet meet their mission. I think we've got some great champions on the call here who are living that out.
Absolutely. Anna, I'm not sure if Anna was able to join us or not, but Anna, if you are here, I wanted to give a chance for you to unmute and say hello as well.
I'm here. Got echo.
If everyone can mute, they're not. All right, let's try. Anna, we'll give you a second. We'll come back to you, but if you want to put anything in the chat while we're working through some of the audio issues. But Anna really serves as the project manager. She is a dental hygienist. Don't want to tell her own story for her, but has been really instrumental in making sure that the grantees in North Carolina are well served and are connected to resources that they need, throughout this initiative. And then we have Dr. Party. I think I'm pronouncing her name incorrectly? Can someone correct me if that is a mispronunciation? Mark, is that
No,
accurate?
you're right. Pardon
Okay.
me. Yeah, Vanessa
All right.
Party.
All right. It's a party with Vanessa Party, huh? All right. She is one of the other TA members for the North Carolina group. And then we have our fabulous Dr. Amy Martin on as well. And so, Amy, do you want to unmute and say something?
Just hi, and would like to emphasize that the cohorts who have been previously funded, such as the speakers on today's call, are fantastic. We have an excellent technical assistance team, but to be a part of this learning community and this network of colleagues that have made all sorts of fantastic mistakes and learned from those lessons and improved upon them. This next cohort is certainly the benefactor of that hard work, and we would look forward to working with any of you.
Thank you, Amy. All right, so I'm going to turn it over to the audience. We pulled out key themes of questions you all submitted in advance, but this is your opportunity to even unmute yourself and ask any questions that you have, to the group. In addition to Janie, Dr. Steele, and Dr. Rios, there are some other grantees on the call as well, and feel free to, also support in answering any of the participants' questions. So I'm going to just open the floor. If folks have questions, feel free to unmute and ask them. Don't be shy.
Hey, this is Eric Tolkien with Smile, North Carolina.
Hi, Eric.
How you doing, Zach? So I'm just wondering, is the grant only open to 501c3 organizations?
So Dr. Martin may be able to provide more context here, but the idea is that they are funded for nonprofits. Yes.
Yeah, shaking my head because I could not figure out how to unmute myself. Yes, so eligible applicants must be nonprofit organizations, and that is per the rules and guidelines from both the Duke Endowment and Blue Cross Blue Shield Foundation.
Thanks very much.
Any other questions? All right, that means you know everything you need to know about this grant opportunity and you are ready to apply, hopefully.
Can I mention something?
Yes, of course.
Yes, I want to mention our center was part of the first cohort, so we were breaking the ice, and we have some information about school-based programs that I got from fellow colleagues like Dr. Donegan and Dr. and Dr. Rob Dougherty. And at the first, I remember the first meeting, we were kind of lost. But the technical support, I remember Dr. Moss came and sitting at our table. He said, hey, I'm gonna be your technical assistant. So I still remember I feel nervous, okay, so he's here now. So, but he was one of the keys with all the Duke Endowment, and Miss Dr. Amy also, Martin was really good and provided us with all the information that we needed. And they were always there for our support. Whenever we have a question, we would call them, and they will give us the answer right away. Or in some cases, let me find out if we can do that, if we can do that. And also another key, just surround yourself with a good team. That's the key. Your team has to be really cohesive, and work together as a team, because at the beginning, when you're buying the equipment and getting ready for preparing the registration forms and everything, it's long hours of work, and you definitely have to have support in those areas. And I cannot be more happy or more appreciative of the help that we received from all the technical assistance team. It was great.
Absolutely. I think there's one point to this as well in terms of the intention around this grant initiative. So as we've talked about sustainability and really, community impact through school-based programs, it's also building this learning community together. And so, you've heard some of the folks mention this before, but it's really important to underscore just how much support there is. So as you go throughout the process of the planning phase and implementation, which we'll talk about here in a second, you have access to the other grantees. So it's really, I think Dr. Martin and the team have really built a lot of intention around making sure that there is an opportunity to be supported by a broader group of folks that have gone through this. So, one of the benefits, and Amy had mentioned this, is the benefactor of, being cohort 4 potentially is that there are 3 other cohorts, and you saw the list of those folks listed in the earlier slides that are there to help support you. So you have the TA team that are really help to guide, but then you also have folks that you can tap into and ask those hard questions to as well of, this is not going well, or I'm concerned about this particular aspect. Can you help me walk through that? And how did you address it? So you're really not on your own in this. I just want to make sure that folks understand, there's really tremendous support as you walk through this grant process. So the grant structure, really the how, and so just want to emphasize there is a readiness phase and TA inclusion in that and coaching, and that's delivered, excuse me, through 15 online training modules. Amy, correct me if there are more or less than 15 at this point, but I think there are 15 focused in 4 domains. You'll get to see Amy on those videos. She's fantastic. I think she must have been an actress in another life. But really helps you walk through. There's an intentional phase around planning and then an implementation phase. So this is phased. It's not all at once. There's a lot of intentionality as this has been developed, again, to make sure that you have the tools necessary to get to launch, to build the program, but build one that's really well thought out and that can be sustained, and that helps address some of those concerns around mission and margin, and that, the delta between the two. You want to make sure that, you can sustain the program. That's the whole point. We already talked about the TA team. Some really important dates to note, though. I just want to make sure that you all understand the process. And again, please correct me. Amy, I did reach out to your team just to make sure that I'm on the right track with dates before I put them up on the screen. But it looks like November 1st, the request for applications will be released. And then there's an informational webinar that will be released from the Duke Endowment on November 18th. That'll have a lot of high, quality content to help answer any additional questions you may have. So you want to be on the lookout for that. And then the application links are actually going to be sent out throughout the week of November 18th through the 26th. So you'll be able to start applying. And then the one that folks are often interested in is when are applications due? And so for cohort 4, the applications will be due on December 10th. And then the award notifications will go out February 15th in 2022. TA team, anybody have anything to add to that?
The only thing I'll add, Zach, is please don't hesitate to wait until November 1st. If you're entertaining an application, please go ahead and follow up. Our team is ready to assist and coach you in that pre-application phase between now and November 1st.
Absolutely. So these are the key dates. Really look for the application links to be sent out again that week of November 18th through the 26th. And then the applications are due on December 10th. But to Dr. Martin's point, really, if you're considering this grant opportunity, go ahead and start that process of outreach, really engaging the team, and you'll have their contact information on the last slide. That way you can walk through any last questions you may have, or really just if you want to talk about the idea, and walk through your proposal. We're also available. I'm happy, Mark. Yes.
Thank you, Zach. So I was just also thinking about, how it must feel to be in a place of uncertainty. So we're all kind of in this COVID world, and to think about taking on a new project is a high risk sort of endeavor. I want to encourage you to reach out to your leadership, to talk to the people in your schools, to find out, what's going on in your community, and will this work? Because we want to work with you and with your communities. And I think the Duke Endowment is very flexible, very grantee friendly, understanding the constraints that we're working with. So this opportunity is kind of time limited. It's not going to go on for 10 years. You have a chance to kind of lower the bar on risks by taking this risk readiness phase and working together to devise a program that works for your community. So think about it, but don't be bashful. Reach out, like Dr. Martin said.
Absolutely, Mark. That's a great point. In light of COVID and really the disruption that it's had, particularly on schools, there's a lot of opportunity to go through the planning and still implement, and still launch. And so things are moving forward, and grantees are still able to accomplish their goals through this grant. So don't let that deter you, but it is something to consider. And if there are questions, feel free to reach out, to any of the folks on the TA team or to myself. We're also going to offer coaching. We've had several sign up from session 1 that really just want to walk through their proposal. So they want to talk about the specifics of their actual program that they want to implement and how that can translate best into a grant application. So any way that we can provide assistance, feel free to let us know. We're happy to do that. Key contacts I mentioned in terms of folks that you may want to have their information. Stacy Warren, the program officer for the Duke Endowment, her email is listed. Katie Eyes, who's the vice president of strategy and programs at Blue Cross North Carolina Foundation, her address is listed. And then all 3 of the TA coaches as well. So Anna, Dr. Moss, and Dr. Party. Anna, I'm so sorry that we were unable to hear you earlier. If you want to unmute and try again, perhaps we'll be able to hear you this time.
Can you hear me?
Yes.
Me and Dr. Moss are in the same room, so we had some echo. Yeah, this is my 2nd year coming into being a technical assistant coach. So I've really enjoyed getting to know the grantees and going through the module set and kind of figuring out what works best for them. We have learned as technical assistance coach probably more than the grantees learn. And we learn every day, and we try to problem solve. And our whole job is to make sure you're successful. So we do whatever we can to make sure you're successful to apply for the implementation grant. So just know that we're in your corner, we're your cheerleaders, we're your sounding board. If you want to call and vent to us, we will be there. We can meet every day if you need. You probably get aggravated with us, but we want to be available to make you successful.
Absolutely. Thank you, Anna. A couple of things in the chat I just want to address before we wrap up and open the floor again for any last questions. Some folks are asking about the recording. Yes, so the recording will go out, and we do encourage folks to share that, even with colleagues they think may be interested in this opportunity. Go ahead and share the recording with them, and everyone that has registered for either session 1 or 2 today will receive the recording, and then it will be made publicly available on the Oral Health Collaborative's website as well. And then one last thing I wanted to mention, I did see some of the some educators from dental hygiene programs across the state with us today, which is fantastic. And I want to say, really the Duke Endowment and Blue Cross Blue Shield foundations are very interested in innovation. So they want to see how can we innovate to build school-based programs that are sustainable. And I think you play a role in that. And so there is a grantee currently from Catawba Valley Community College that was able to partner with their local health department to still build a school-based oral health program. So if you're interested, certainly reach out and certainly apply as well. So there is precedent for that. I can attest that the folks that are reviewing the grant applications are really looking for ways to innovate and think outside of the box, but still accomplish the same goals, of building access points to comp care for kids across North Carolina. So I'm going to open one last time for additional questions. If folks have them, feel free to unmute. We would love to hear from you. And like I said, feel free to reach out also if you have any questions that didn't get addressed or that you didn't think of during today's session. Any additional questions that folks have? Any parting words from either the grantees or the TA team that's with us today? All right. Well, with that, we're going to end and give you 10 minutes back on your Tuesday. And so please do reach out if you have any questions. And like I said, I'll make sure that the recording goes out to folks following the meeting. All right. Take care. Bye-bye.